It almost always starts with something that sounds simple. A cough that just won't go away. But what if that cough isn't just a cough? What if it's the first clue in a medical mystery? Well, that's exactly what we're diving into today. We're going to follow the clues that lead to a diagnosis of a lifelong lung condition called bronchiectasis, what it is, how doctors find it, and what it's really like to live with.
Okay, so this is where it all kicks off. A doctor gets a request that sounds pretty routine, right? Please examine this patient who has a cough productive of thick sputum. It sounds so standard. But that one sentence, it's the starting pistol for an investigation that could uncover a serious, hidden condition. The whole journey really begins by just listening. First to the patient's story, and then really listening to their lungs.
All right, let's talk about that cough. The key thing here is that it's not your average, everyday cough you get with a cold. No, this one sticks around, and it's what doctors call productive, which is just a way of saying the person is coughing up a lot of thick gunk or sputum. And that is our very first super important clue that something's not right deep inside the airways. So with that first big clue, the cough, the doctor starts the physical exam. They're basically on the hunt for more evidence, looking for these specific telltale signs that'll help them solve the puzzle. And what's really wild is that some of the biggest clues are hiding in plain sight, literally at the patient's fingertips. Okay, so this is one of the most classic signs a doctor looks for. A healthy fingernail has a pretty normal, smooth curve to it. But look at the difference with something called finger clubbing. See how the tissue at the bottom of the nail looks swollen and puffy, and the nail itself curves way down, kind of like an upside-down spoon? This isn't just a cosmetic thing. It's a huge red flag. It's a sign that the body might be struggling to get enough oxygen, and that points a big, flashing arrow right at the lungs.
The clues don't stop at the fingers. The exam might also show signs of long-term strain on the body, like something called cor pulmonale. That's basically a fancy term for when the right side of the heart is struggling because of chronic lung problems. But the real smoking gun comes when the doctor listens to the chest with a stethoscope. They might hear these coarse, rattling sounds. They're called inspiratory crackles, and what you're hearing is literally the sound of air trying to force its way through airways that are all gunked up with mucus.
Okay, let's take stock. We've got the patient's story of a chronic, productive cough. We have the visual clue of finger clubbing, and we have those distinct crackling sounds from the chest. All these pieces of the puzzle are starting to fit together, and now we're at a point where we can finally give this thing a name.
And that name is bronchiectasis. The most important thing to get here is that this is a permanent condition. What's happened is that the airways, the bronchi, have been damaged. They've become abnormally widened, thickened, and scarred up. I love this analogy. Think of them like rubber bands that have been stretched out so much they've lost their snap. They can't spring back anymore. Because of that damage, it becomes super hard to clear out mucus. So the mucus just sits there, it builds up, and that creates this nasty, vicious cycle of coughing and getting infections over and over again.
So, you're probably wondering what causes this kind of permanent damage. Well, it usually boils down to a few main culprits. A big one is damage left behind by really bad infections from the past. We're talking severe pneumonia, tuberculosis, even something like measles. Then you've got other chronic lung diseases, especially COPD, which can lead to this kind of damage over a long time. And finally, it can be tied to genetic conditions, with the most well-known being cystic fibrosis, which messes with the body's whole system for managing mucus.
All right, so the physical exam gives us a really strong suspicion. But to be 100% sure and to see just how bad the damage is, we've got to actually look inside the lungs. And that's where modern medical imaging becomes absolutely critical. You can think of the diagnostic process like a funnel, where doctors get more and more specific. It usually starts with a simple chest x-ray. This might show some early clues like little shadows that look like tram lines. But to really nail the diagnosis, the gold standard, the absolute best test we have is a high-resolution CT scan. After that, they might test the sputum to see what specific bacteria are hanging out in there. And finally, they'll do a breathing test called spirometry to see how well the lungs are actually working. Put it all together, and you get a complete picture. And this is the money shot from that CT scan. It's what radiologists are looking for. It's called the signet ring sign, and it's a fantastic analogy. See, in a healthy lung, an airway and the little blood vessel right next to it are about the same size. But with bronchiectasis, the airway gets so wide and dilated that it looks huge compared to the tiny artery next to it. It literally looks like a big ring with a tiny little diamond set in it. When a radiologist sees this, it's the definitive, unmistakable visual proof.
So once the diagnosis is confirmed, the entire game plan pivots.
It's no longer about finding out what it is, it's about figuring out how to live with it. And because this is a permanent, chronic condition, it means developing a daily, proactive routine to manage the symptoms and keep those airways as clear as possible.
And that management strategy really rests on 4 main pillars. First, and this is probably the most important, is physiotherapy. This involves daily exercises and techniques to physically clear all that gunk out of the lungs. Second, you have antibiotics, both to knock out active infections when they pop up and sometimes for long-term use to keep them at bay. Third are bronchodilators, which help relax and open up the airways to make breathing a little easier. And finally, there are mucolytics, meds that help thin out that super thick sputum so it's actually possible to cough it up and out.
So, think about that journey. We went from a simple cough to a clue hidden in the fingertips, all the way to that signet ring on a high-tech scan. We've traced the entire diagnostic path, but for the person who gets that diagnosis, this is really just the beginning of their journey. That daily management plan we just talked about, it's a huge commitment, a real testament to their resilience. It really makes you think, doesn't it? Understanding a condition like this isn't just about the cool science of diagnosis. It's about appreciating the incredible daily effort it takes to live well with it day in and day out.